Our next guest has been dealing with a big problem due to her breasts. Check out this story.
My name is Lindsay Pelas, and I'm 26 years old. I live in Los Angeles, and I have 6.8 million followers on Instagram. One of the major reasons I think I have almost 7 million Instagram followers is because I have 32 triple D breasts, and they're natural, so it's kind of a unique look. When I moved here, I actually did a viral video where I ran in slow-mo, and it got like almost 10 million views on YouTube, and so I've been modeling and acting and doing that ever since. Having big boobs is not all it's cracked up to be. I've even weighed them before. They weigh 11 pounds. I feel beautiful this way, but lately I've been feeling this nagging pain in my lower left side of my back in particular. Some days it hurts all over, and I'm not sure where it's coming from. Sometimes I'm just like, oh my God, this is really bad. What is it?
After years of back pain, it was time for Lindsay to get some answers, so we sent her to board-certified orthopedic spine surgeon, Dr. Hooman Melamed.
Some back pain for some time.
Yeah.
But it's really gotten bad the last few months, basically.
The last few months, and I don't know if it's because I had big boobs.
The main pain is basically up here.
Yeah.
When do you get it most of the time?
The pain in my back comes usually nightly is when I'm noticing it. So after a long day of traveling or a long day of shooting.
What about this pain here, which is the more intense pain?
When I fly, I come back home and I'm usually sore for a few days.
What are some of the exercise regimens you're doing?
I do Pilates, various boot camps.
The most important thing in Pilates is the form is very critical. So if you're doing something the wrong way, that's obviously not a good thing. Once you step down, please walk on your tippy toes. Excellent. Can you go bend down like that? Let me see how flexible you are. Go back. How far can you go back? Okay, good, good. Just kind of shaking the hips there and go back and then tilt to the side. I think the breast size is an issue. I've had few patients like that, but you're still very young right now for that to become a major issue. It usually tends to catch up to them in their 40s and 50s. Anybody who complains from back pain more than 3 months or more, it's automatically you got to get imaging studies done. You want to make sure that we're not missing anything else. So we just need to get some imaging done. Get an MRI. I want to make sure the discs look okay, the spinal cord looks okay, there's nothing pinching your nerves.
Please welcome Lindsay and Dr. Melamed to the show. Welcome. Good to have you. Now, what did you find on that examination?
The great news is that zero structural problems, a perfect spine.
That's good.
On the MRI and the X-ray shows. So there's nothing structurally wrong with it. All the discs look healthy, and the balance alignment looks perfect.
What do you think is causing the pain?
She says lately she's been traveling a lot, sitting on the plane for a prolonged period of time, or being more modeling, so you're standing for a period of time. The body hates being in one position constantly. You know,
especially in heels. If she's modeling in high heels, that may
And do you think it's harder to maintain good posture because of that extra weight?
Of course, the center of the gravity wants to, pull you down, especially being short stature. So you're not broad shoulders. So your spine, it's like having a text neck. You're down with your phone, basically.
Well, Lindsay, I was going to ask, even watching you now, it seems like your shoulders are forward and you're in almost this hunch. Is it hard for you to open up your chest and get that spine and...
I could sit like this, but I'd really have to focus on it. I guess I really don't think I'm naturally prone to doing this.
You just have to really work on focus a lot more on these muscles like back here, all the way from the trap, all the way down to the lower back muscles here.
So you would
Pilates,
say core strength.
Yeah, exactly.
And the back strengthening that you recommend for all of us that have come to see you with our back problems.
Absolutely. Plyometrics, a lot of like using your own body weight, nothing go crazy, like bodybuilding type. There's a lot of great exercises out there.
Make sure you're wearing the right bra. Make sure you get fitted. Make sure, because not all bras are created the same. You can be wearing the wrong bra that you shouldn't be that uncomfortable by the end of the day. So the right bra
and heels too. We got to be careful not to be as much as heels when you're traveling, the long flights, wear comfortable shoes on those flights and try to get up and walk around, not to be sitting for like 12 hours, like nonstop, basically.
Yeah, that makes sense.
These are all, I think, good takeaways. Lindsay, thank you for sharing your story. Best of luck to you. Dr. Melamed.